cesarean are more common than vaginal only because the surgery itself includes an incision right down the linea alba that is usually not stitched up. So when that happens and there's an overload in the tissues, that may result in an umbilical hernia. Now, how do we prevent this from happening? A lot of controlling of intra-abdominal pressure through the ABCs, alignment, breathing, core control. It's the first diastasis exercise. Umbilical hernias and hernias in general don't resolve on their own. They're generally surgical. But not all hernias need to be surgically repaired. You can live a pretty active life that is pain-free without having to correct it. Make sure you have good load management. Every body is different. Now, just right after your surgery, it's going to be painful for weeks afterwards. And then when you start scar massage, internal incisional pain will be common. I mean, it's supposed to happen. But if you're ever in doubt, ask your doctor. Yes to walking. And then the other thing you can definitely do at 3 weeks post-cesarean or vaginal are the ABCs. Alignment, breathing, core control. It's the first place you want to start for diastasis recovery. I'll link that program below. Scar massage in the first 6 weeks looks like this. It's very, very, very delicate. This is called desensitization, and it looks like piano keys just on the surface of the skin. It decreases pain, swelling, and numbness. After you're discharged by your doctor, you can start more progressive scar massage techniques like pull and hold and small circles. And these all can progress to larger and deeper techniques. Potentially. I mean, you'd have to get it assessed in person by a perinatal therapist ideally, and they'll have a combination of manual therapy techniques and tools like cups and maybe even the dolphin neurostim. This often coincides with increased movement because you're less in pain, but then of course with increased movement, if it's too much, it can cause discomfort at the scar. Also, if the scar massage that you're using is a little bit too aggressive. An awesome question, and you're going to be surprised at my answer. It's actually movement errors, meaning not retraining how to move properly, meaning core control, breathing, and posture is a little bit off, and that leads to more injuries. So I'm not trying to be vague, but the movements and exercises to avoid are the ones your body is not ready for, either from a movement perspective or a strength perspective. So start with your ABCs. It's never too late. Now, if you're years post-cesarean and you're still finding that there are mobility issues, definitely connect with a perinatal therapist because manual techniques and tools may help, but honestly, the right exercises make the biggest difference. Hello, everybody, and welcome to Monday Q&A.